ESG stands for Endoscopic Sleeve Gastroplasty. And in the most simplest form, you take the stomach and you think of it as a reservoir, a container to hold the food that we eat. ESG goes through your mouth to go down with a flexible endoscope, and it makes that container, your stomach, smaller. Okay. We do it by using suture to grab onto the wall of the stomach in multiple places and fold the stomach in on itself. Okay, so you're sewing portions of the stomach shut from the inside. That allows you to avoid surgery, okay, because it's done all through the mouth. You get maybe a 70 to 80% reduction in the size of the stomach. With that, you feel full faster, you feel full for longer, and you ultimately lose weight because of it.
Interesting. Okay. Now, who would be the ideal candidate for this type of procedure?
Sure. When we think about the medications that we mentioned earlier, the GLP-1s, they start at a BMI cutoff of maybe 27. For a traditional sleeve gastrectomy or gastric bypass, the BMI cutoff is 35 with comorbidities such as blood pressure or cholesterol or heart disease or joint disease, or a BMI of 40 without any of those comorbidities. This ESG, the endoscopic sleeve gastroplasty, falls nicely in between those two. It's indicated for a BMI range from 30 up to 50. Okay, so a little lower threshold of entry. With that, most of our patients fall between that BMI of 30 and 40 range. Okay, and so it is a great procedure for those patients. Once you get to the further end of the BMI spectrum, the weight loss may not be as great. Okay, you look at about 49% of excess weight loss in 1 year with the ESG. Okay, that is pretty good average, and all of that is coupled with diet and exercise. Okay, it's not quite as great as your traditional bariatric procedures, but you're avoiding the risk of going to surgery. Bariatric procedures nowadays is very safe. It's equivalent to a gallbladder surgery or a hysterectomy. However, the ESG safety profile is even better than that. Okay, so a lot of patients, this is going to be a great option for, especially if they've had some success on the GLP-1 medications, but maybe it's not sustainable due to GI symptoms or the financial component of it. With ESG, it's different than traditional surgery in that with a sleeve gastrectomy, which would be a good comparison, you're removing about 2/3 of the stomach from the patient's body. With an ESG, you're folding that same portion of the stomach in upon itself. You're still reducing the capacity of the stomach, but you're not removing that portion of the stomach completely. Okay, you're just closing it off. Okay, so food comes down into the stomach, still moves into the small intestine as it would, but you're just reducing the size.
Okay. Why wouldn't everyone just get this procedure? It seems like it's the perfect solution. Is it hard to get insurance or something to approve that procedure?
So it is a newer procedure, and that has been part of it. Hopefully we can spread awareness for it. But right now, the weight loss isn't quite as significant as the traditional bariatric procedures. It's still good. 15% total body weight loss over the course of a year, or 49% excess body weight loss over the course of the year, depending on how you want to look at it. So it's still a good and reliable procedure. The durability has also been studied looking at 2-year, 5-year data, but it's not quite out to 10-year. It's not out to 15-year that we see with our traditional bariatric procedures. And so with that, with the novelty, some patients may choose to go the traditional route. But when you think about recovery, ESG is a lot faster. Typically, it's done as an outpatient. So you come in that morning, you go home that afternoon. You spend a couple of days with kind of riding the couch, watching TV, getting up around the house, and then 2 or 3 days go by. Most people return to their daily activities. They're going back to work. They're participating in life as you would expect without having any sort of surgery. Okay.
That's impressive. And that answered my question. What lifestyle commitments are required post-surgery?
Yeah. With any bariatric procedure, we want you committing to good food choices, portion control, meeting with our dietary counselors, exercising. And so you have to commit fully to undergoing this lifestyle change more than just depending on the procedure as the fix. And so you do have to commit. With any sort of bariatric procedure, we have multiple phases that we go through with their diet post-operatively. And so typically we start with what's called a clear liquid diet, where it's more broth-based, as we progress back up to soft and eventually regular diets. Okay.
Another thing I have a question about is earlier, one of the doctors mentioned that when you do the traditional surgery, you lose a lot of nutrients. Is that sort of the same for this type of procedure?
It is less so. With the Roux-en-Y gastric bypass, we worry the most about malabsorption of some nutrients. And so all patients need dietary counseling, but for Roux-en-Y gastric bypass, you really have to stay on top of your supplementations with vitamins. For sleeve, it's very important as well. For ESG, you still have to take a multivitamin following the surgery. But if you miss a day, it's not as crucial to where the Roux-en-Y gastric bypass, you need to really stay on top of it. And within our normal follow-up protocol, which is typically 2 weeks, 1 month, and then every 3 months, we are checking labs on you to make sure that there are no deficiencies that could occur.
You've already mentioned, but let's talk about just straight up, how much weight can someone expect to lose?
Yeah. With the ESG, a patient would expect to lose about 15% of their body weight at 1 year. With excess body weight, which is a little bit different calculation, but you would expect to lose about half of that excess body weight over that same year. Okay. And that's tied to diet and exercise as well. Okay.
Perfect. Are there any risk or downside that people should be aware of when approaching this procedure?
Sure. With ESG, one of the risks or downsides we think about is that initial recovery period where patients might have nausea, vomiting, cramping. Those are the most common kind of GI complaints after the surgery or after the procedure. Most of that goes away pretty quickly. There are some rare kind of adverse events that we talk about. Those are things like bleeding. That would be an abscess forming along the lining of the stomach. Those are rare. Okay. In fact, ESG has a better safety profile than a sleeve gastrectomy or a Roux-en-Y gastric bypass. And so for that reason, we're excited to get it here into the area.
Totally. It seems like by far the best option. Do you have a patient story that highlights an ESG example or a highlight where it was you had a lot of success? Someone had a lot of success.
Okay. For the ESG, with weight loss, with getting over surgery, we had a patient have a procedure. The procedure was performed on a Tuesday. That next week, they had a work dinner where they had to go and be social and active. They were very worried about, would I be ready for this following this procedure? They were able to make the dinner, engage with important clients, and really not skip a beat. And so having that quick, fast recovery while having transformation in your kind of life and quality of life downstream was really great to hear. And so I think the quick recovery is one of the best aspects of the ESG.
I also think there's something to be said about not losing your stomach. You know what I mean? To know that it's still it's still there.
Sure. When ESG was kind of brought out, we used sutures to reduce the size of the stomach. Technically, If patients were having issues or they were having any intolerance to foods, you could go back down, remove those sutures. And so the stomach over time could re-expand. And you haven't really burnt any bridges, so to say, because you're still left with your stomach. You're still left with what you were born with. And so that is good. Now, if it has been years and years and years since your ESG, your body may have scarred in and that re-expansion may be difficult. But initially up front, the ability or the reversibility of the ESG is another highlight.